Hello, my name is Dr. Gwen DuBois. I'm an internist and president of Chesapeake Physicians for Social Responsibility. I'm alarmed that men, women, and children are still living in crowded shelters and encampments, putting them and the city at risk of an explosive outbreak of COVID-19. Even without this pandemic, housing is health. Inadequate housing is associated with chronic asthma, and it's very dangerous for the development of children, especially those under 5. The homeless have a 5 to 10 times higher mortality rate than the housed. Their expected average length of life is less than 52 years. And this is before COVID-19. A study in Massachusetts found that providing housing and health care to the homeless saved $15,000 per person per year. There were fewer hospitalizations, less incarceration, and this was before COVID-19. And now with this terrible pandemic, we are asked to wash our hands and often practice physical separation, stay at home. None of this can be done by the homeless. And how will they get their food? This is a population with a high rate of chronic illness, heart disease, lung disease, diabetes. Some are elderly. Some have depression. Some have drug addiction. And they are at very high risk of getting COVID-19 and getting very sick, requiring hospitalization. Many will die unless we intervene. We are trying to bend the curve of COVID-19 illness and reduce hospitalizations and respiratory failure. Now, empty hotel beds and facilities are being used in England to house the elderly and chronically ill homeless. We must do this here, with the goal of offering such accommodations to every individual in the city who will accept it. If providing housing and health care in normal times saves money, one can only imagine how much more money and lives will be saved providing housing during the pandemic, where fewer children and adults will become infected. This helps hospitals and healthcare providers too. It helps everyone. It is the right thing to do. It is good for our children. Mayor Young, Governor Hogan, please work together to rapidly find housing for the homeless, develop programs to prevent evictions for renters and homeowners, supplement and increase emergency feeding programs. This may be temporary for now, but these programs could be a way to try to reduce homelessness and evictions permanently to a low number as possible. Remember, housing is health.